Footage of people in masked hospital corridors and CDC officials at a press conference briefings. Nearly 5 years after the first global COVID outbreak, a new variant is making headline again. Meet BA.2.86.2, a subvariant of Omicron now being tracked closely by health authorities in US and abroad. Visuals animation of a virus mutating and spread across a US map, nicknamed Pylora 2 by some scientists. This latest COVID-25 variant is raising concern not just for its transmission rate but for the spike hospitalizations it's driving in several states. Case number and hospitalization map highlighting California, Texas, Florida, and New York. Over the past 3 weeks, hospital admissions tied to respiratory illness have jumped by 18 nationwide. According to the CDC, the largest spikes are being seen in California, Texas, Florida, and New York, where some hospitals are once again nearing ICU capacity. ER footage and interviews with healthcare workers. Healthcare workers say that it's not like 2020 all over again, but we are seeing a noticeable uptick, especially in older patients and those with chronic condition. Unlike earlier moves, most severe cases now involve immunocompromised individuals, seniors, or the unvaccinated. However, symptoms like fatigue, cough, and low-grade fever are effective even the boosted population. What is BA.2.86.2 breakdown of BA.2.86.2 with labeled spike protein multination? BA.2.86.2 is a subline of a highly motivated BA.2.86 strain but fast detected in 2023. It carries over 30 spike protein mutations, some of which allow it to partially evade existing immunity. Early lab studies suggest that while current vaccines still provide protection against severe disease, their effectiveness as preventing infection is lower, similar to what we saw with early Omicron variant. CDC press conference. CDC officials say that we are monitoring BA.2.86.2 closely and working with partners to assess vaccine updates ahead of the fall. Masking and mitigation. Hospitals reinstating mask signage, people putting on face coverings. As a precaution, several hospitals and clinics in Chicago, Boston, and Los Angeles have restricted indoor masking requirements for staff and visitors, particularly in emergency rooms and long-term care facilities. While no federal mandates are in place, the CDC has recommended masking in healthcare settings where transmission is invalid. Some local school districts are also preparing hybrid learning plans just in case. Parents with children in classroom. Public health officials emphasized that widespread clusters are not expected thanks to improved treatment protocols and high level of population immunity. What comes next? Timelines of updated boosters ability in fall 2025. A new fall 2025 booster tailored to cover both XBB and BA.2.86.2 strain is set to roll out by mid-September. The CDC is urging older adults, those with chronic illness, and healthcare workers to get vaccinated early. Officials also stress the importance of flu and RSV shots the season as the US braces for what could be a triple wave of respiratory illness reading into the colder months. Seasons of the crowd pharmacy. Public health experts say that is not panic time, but it is prepare time. Stay informed, get vaccinated, and take smart precaution. A nurse vaccinated a patient, a COVID test swab, a family wearing mask at an airport. The COVID 2025 story is not over, but with elegance, science, and smart policy, we have come a long way. The key now, stay ahead of curve. CDC COVID Tracker, new booster available September 2025. Subscribe for updates on health, science, and public safety.